Afternoon to my cabinet colleagues, Minister Cox, Minister Dialsingh, Minister Garcia, all of the media personnel, and most importantly, all of our viewing and listening public in Trinidad and Tobago and outside. This afternoon, I pick up the conversation from where I left it off on Saturday last. And really, it is to remind people what it is we're doing with our borders. As you all are aware, it was on the 23rd of March that we closed our borders to both nationals and non-nationals. As we've stated already, and it's worth stating again, all of our nationals will return, and we are very sympathetic and have a lot of empathy for all of our nationals who are outside of Trinidad and Tobago who wish to return. As we've said repeatedly, there are over 330,000 nationals outside of Trinidad and Tobago, and at the Ministry of National Security, we have literally been receiving thousands of requests. Now, the management of allowing persons back into Trinidad and Tobago is being done very carefully along with our public health system. What we're doing is we're balancing really a few things. First of all, we took a policy decision as a government to state quarantine all persons returning. You've heard from the Minister of Health, the Chief Medical Officer, and other medical personnel over the last few days and weeks how we're doing with the COVID management in Trinidad. So one of the things we decided to do, every single national returning, we have been putting them into state quarantine facilities. As we also started to have a little bit more capacity, we've been dealing with certain very small categories of people and having them in state supervised quarantine facilities. That is about to start, and I'll give you the details with respect to that in a short while. So the balancing exercise is not only the capacity that our public health care system can do from the point of view of quarantining people, because then, of course, if there are positive cases of COVID there and we've quarantined them, at least we'll be making sure that the people can be treated and they have not gone out with their positive cases into our community and we begin to have community spread in Trinidad. That's the policy decision and the reasoning based on science and medical evidence for the state quarantine. So that's the first capacity issue. How many can we really hold in our state quarantine facilities? Of course, you cannot mix people coming from different jurisdictions all together, because then you run the risk of contamination and spread amongst different groups of persons who may have come in without the virus, mixing with others who may have come in with the virus. The next issue that we are always balancing, and which plays a part in the formula, is, God forbid, if there is in fact a spread of persons who have re-imported the virus into Trinidad, we need to make sure that our parallel healthcare system, built out to handle positive COVID cases, is not overrun. So those are the factors, those are the considerations. They're secondary considerations that we are bearing in mind, persons being repatriated from areas where there's still the spread of COVID taking place. Because whilst Trinidad and Tobago is in a good place, and that's by no fluke, while we are in a good place with our COVID cases and the management of it, there are other jurisdictions in the world where it is still being spread. There's still thousands of persons being diagnosed on a daily basis and deaths taking place. So understanding that those are the deciding factors, I'd now like to give an update as to exactly where we are with respect to the numbers, because you all would have heard me say on Saturday that we are bringing back close to 1,000 persons. That week has started. So the first thing I'd like to say is yesterday, we finally got the return of some persons who had been given well over a month ago permission to return to Trinidad from Guyana. So we had 9 return yesterday, and they are currently in state quarantine. We are also having some more cruise ship workers come in. At this stage, we have 3 additional sets of cruise ship workers who are scheduled to come to Trinidad and Tobago. We've granted the exemption. We have the Disney Cruise Line who are bringing another 7 workers. They are scheduled to arrive on Tuesday, the 16th of June. We have the Norwegian Cruise Line who are bringing 19 plus 1 permanent resident, so 20 persons on Monday, the 15th of June. Then we expect on Friday, in 2 days' time, the 12th, about 326 to 360 Trinidad and Tobago nationals to return on the Royal Caribbean cruise ship. Right now, they're being consolidated in Barbados. They're stocking up with supplies. Now, what is interesting, the number keeps going up, it keeps coming down as nationals on these cruise ships take decisions as to whether they want to come to Trinidad or they don't want to come to Trinidad. So right now we're catering for 326 to 360 nationals on the Royal Caribbean Cruise Line. We have negotiated, I'm happy to say, that a specific dedicated vessel will be used for the quarantine of all of these nationals. When they come in, we've made arrangements, our health personnel, to test every single one of the nationals. Those tests will then be put into the system. They will all be quarantined on the ship in separate rooms, separate cabins, with their own washroom facilities to keep that quarantine safe. They will be monitored on a daily basis. This is an important point. All of the personnel who are being allowed into Trinidad are being monitored daily by our health personnel. So it's not only about capacity of rooms in the state quarantine sector, it's not only about possible availability of other rooms outside, for example, in some hotels that I'll get to in a short while, but we also need to make sure that we have the medical personnel available to, on a daily basis, monitor everyone who's under quarantine. So of course, those numbers begin to add up. So these 326 to 360 cruise ship nationals, cruise ship workers or nationals will be on this ship for 14 days, and we will do the monitoring process. If persons present positive, out of anyone who returns, they will be immediately taken into our parallel healthcare system set up to deal with positive COVID cases. So we always need to be mindful of those numbers. We are also having, and we're in the throes of the final stages of confirming our University of West Indies students returning from Barbados, 85, and right now we have 167 UE students who are up in Mona, up in Jamaica, who are also looking to return. So we're working out the flights. It may be that on Saturday, those from Jamaica return, and then on Monday, those from Barbados return. We're also in contact with the authorities in both Barbados and Jamaica to help them with the repatriation of their students. So already just with those two categories alone, we're well over 600 persons who will be in our public health care system under quarantine. In addition to that, there are some students who are on ships outside. They're doing a maritime degree or maritime courses with the University of Trinidad and Tobago. And as part of that, they have the practical side where they must go out on certain cargo ships and be out at sea for a number of months. We have been letting those students, as the ships return, disembark and go into state quarantine. So there's a few small numbers there as well. And there are some instances like this where some nationals as well, during the course of return via their yachts, we've quarantined them in Shaka Shikari under the Trinidad and Tobago Coast Guard, and after they finish their period and they're tested, they're allowed to disembark. In addition, you all would have heard me mention that we successfully managed to negotiate a company that had 5 workers in St. Kitts and Nevis to pick up Mr. Jaglal Singh, visually impaired gentleman who was in St. Lucia with underlying health factors. They were coming in today, or they may have arrived by now. So 5 of them, and they would be the first persons that we managed to negotiate. Their employer was willing to pay for them to be under state-supervised quarantine in a hotel. So they are the first 5 that will go into state-supervised quarantine at a hotel at their own, the employer's expense, but on a daily basis be subject to our doctors doing their monitoring. So Jaglal Singh will go into the free state quarantine system. We also have, finally, it appears, our nationals who have been in Venezuela. We have 29 of them returning this Friday, the 12th. We have also managed to fit in 49 of our nationals who have been working in the Gulf of Mexico, 2 separate companies, one with 38 and another one with 11. So that's 49 of our nationals returning from Mexico. They will be the second set of persons, or another set of persons who have agreed, their employers have agreed, they're working in the oil and gas industry, to allow them to quarantine in a specific hotel identified by our Ministry of Health personnel, and they will be there at the expense of their employers, but under the state-supervised quarantine. It is not possible for us to just open up and allow all of our nationals to return based on the number of hotel rooms, etc. Because as I'm saying, there are 2 important factors: that we have the medical personnel who can on a daily basis examine these persons, make sure they're keeping in accordance with the state quarantine protocols as outlined by the Chief Medical Officer, But then also, we also always have to factor in the overall numbers. If there are outbreaks and there are persons who've re-imported COVID and we start to have a positive spread, can our medical system that has been built out to deal with positive COVID cases facilitate them? So those are the main factors. So we also have the group returning from Curacao. The government of Curacao is coming to repatriate their personnel, and there were only 4 nationals. So we could manage to fit in those 4 nationals into our current state quarantine facilities. So they are supposed to return, we're hoping, on the 11th of June. In addition to this, there are a few in between that we have, and we're also looking at the possibility when bringing in the UE students from Barbados. There are a couple other students that we may be able to bring in. In a nutshell, those are the main categories of persons, there are also the deportees who are being deported from the United States. That is towards the end of this month. So we're also preparing facilities for 26 potential deportees to be deported back to Trinidad and Tobago. I have seen it reported in the newspapers as well that one of our ambassadors, our ambassador to the United Nations, Ambassador Beckles, she did request an exemption. Her being an ambassador returning to Trinidad and Tobago, that exemption has been granted. She is making her way back here of her own volition, making her own arrangements, and she will also be put into quarantine facilities and pay for her own quarantine facilities. So she will be under state supervised quarantine. Additionally, there was a possibility, and we managed to negotiate it, for a small plane to bring back a few persons, a mother who recently had a child and was suffering some issues related to that child and a family. We managed to be able to fit them in as well under the state supervision quarantine. As the government, we would love to be able to just open up and bring back all of our nationals or larger numbers of nationals. But the numbers that I've just told you all about equate to over 850. And to have 850 in our system for the next 14 days as we manage it, as we monitor, we believe there may be certain positive cases. In fact, I was just sent a story coming out of Barbados this morning with their repatriation, out of their repatriation. And just in the last 24 or 48 hours, there were 4 positive cases. So we believe there is the likelihood or the great possibility that in the repatriation of our nationals, there will be positive cases that will present, and we need to be able to manage it. As you would all be aware by now, it's normally a 14-day quarantine period, so that is also another factor. So the next big batches that we will be looking at of allowing nationals to return, because we have significant numbers of our nationals in the United States, in Canada, the United Kingdom, who have been writing and asking to return, and we want to get to the point where we can allow them to return, but we need to get through the next 2-week period with this 800 plus that I've just listed here, and then after that, if persons present positive, we need to air out the facilities, but we will balance the numbers. So we really move in 14-day cycles and the availability and the capacity. So far, fortunately, in the repatriations that we've had within the last recent times, we've only had 1 positive case present. The first set of cruise ship workers, some of them have already gone home. So we are managing the numbers. So the message I'd like to send to all of our nationals, because they correspond with me daily, they send messages to my phone, they've been retaining lawyers, they've been sending messages through the media. We want to bring all of you home, and you will all be allowed to be brought home. But it has to continue to be in this very managed and controlled manner to continue to protect the population of Trinidad and Tobago. We have managed to protect all of those who are here present in Trinidad and Tobago. And it would be a crying shame at this stage for us to lose the results of all of this that we've all been doing as individuals over the past few months. We are going to get to the point of bringing back our nationals from the United States, from Canada, from the United Kingdom, and from other areas, the same way we've been managing now. Once we get over these large categories of numbers, we will then immediately be moving, and we'll be looking at the timing for allowing these persons to return and how to manage that process in our state quarantine facilities, and for some who we may be able to put in the state supervised quarantine facilities. The next issue I'd like to discuss with you all today is there is a group of workers, a group of nationals who are farm workers in Trinidad who on a seasonal basis have gone to Canada to work on farms in Canada, and they have been requesting the opportunity for themselves to go to Canada. There are a few messages I'd like to send. We know as a fact that these farms in the Alberta province as well as the Ontario province do have positive COVID cases. We know for a fact that these farms in Alberta and in Ontario have been having COVID spread. In fact, unfortunately, very recently, workers from other CARICOM islands, we've had a few deaths at these farms. So we're aware that the farms have the potential to be spreading COVID. That's point number one. Two, the Canadian authorities have a specific, there's no free healthcare in Canada, the way we have free healthcare here in Trinidad. So we're also mindful of this, of our nationals going abroad and being exposed and catching COVID virus and being exposed in Canada. They are not able to get the Canadian health insurance as well when we've done the research. So they will be out there with the potential of being exposed to COVID, becoming positive COVID cases and not being able to get the medical healthcare attention. We as a cabinet have discussed this. We do not want to prevent any of our nationals from leaving our shores to go and take up employment opportunities elsewhere. So the Attorney General's office has been in contact with other jurisdictions. There is going to be a certain indemnity letter for each one of these workers to sign, acknowledging that they are putting themselves at risk, acknowledging that where they're going to, there are positive cases of COVID, and there is the possibility that they may contract the COVID through spread, and then furthermore, that if they do so, they will not be allowed to get medical health care in the Canadian system unless they have insurance, and they will not be available to get insurance. They don't qualify for the insurance in Canada. So they're doing so, in other words, at their own risk. We, the government, have warned them, but as I say, we're not going to stand in the way of these workers going. That document is currently being prepared by the Attorney General. I will grant, as the Minister of National Security, permission for all of these workers to make their way. They will have to make their arrangements to make their way to these Canadian farms and then to go ahead and to work. Of course, they will be subject to the same thing like all of our nationals outside, that if when they're ready to return home, our borders remain closed, they will be subject to the exact exercise that has been taking place since the 23rd of March. No guarantee of date of return as we continue to manage the system. There will also be one important condition put to them, that if when they're ready to return and we can grant them permission to return and the borders are still closed, they will have to pay for their own quarantine facilities when they return to Trinidad and Tobago. So that's the other issue I wanted to address today, to let all of those workers who wish to go to the Canadian farms know that the Cabinet has taken the decision that they may proceed to go and work, understanding the risks that they're putting themselves at, but we will facilitate their departure to go to Canada from the point of view of granting the exemptions. I'm sure they will make the arrangements to be able to get up to Canada and to continue with the work that they would like to do there. So in a nutshell, the main points were that we continue to allow the entrance of nationals. Over the next 14-day period, we are not going to be in a position to accept large amounts of nationals coming home because we are at full capacity with our state quarantine facilities as well as our state supervised quarantining with our medical personnel being not stretched but at capacity. So for the next 2-week period, we're not going to be in a position to take on any more large numbers. There may still be opportunities because there are a couple others that we're looking at and that we've granted exemptions to, some of whom will be corresponded with within the next 24 hours in small groups who may be able to come back to fit into the limited spaces we have left in our state quarantine facilities or the state supervised facilities. In addition to all of this, we have continued to be working with the energy sector and allowing, I forgot one category, of workers as well. There's a rig outside there that came in from some other area of the world, and before they hit our borders a few weeks ago, their contract in Trinidad was terminated, so I think they went to Aruba. There are about 68 nationals as well in the next week who will be returning on this rig that we've granted exemptions for. Those 68 nationals will be allowed to quarantine on the rig. So they also fall into this category of about 850 plus people that we'll be handling, monitoring, assessing, and keeping our eyes on in state quarantine facilities or state supervised facilities over the next 14-day period. And during that period, we will start to calculate and work out who are the next big batches of persons that we will allow in. So to all our nationals outside there, we understand how difficult it is for each and every one of you, those who have the medical circumstances, those who are in difficulty. Unfortunately, because of this global pandemic, we remain steadfast in trying to get you home, but our message to you, until we can get you home via the exemption process that I've described, please continue to shelter in place. We are aware of your difficult circumstances, and we are working as fast as we can, including trying to expand our capacity to be able to bring you home as soon as possible. Thank you very much.